Language delay is when a child fails to develop language skills at the usual age-appropriate period. Language delays are distinct from speech delays, in which kid might use words and phrases to express ideas but be hard to understand. First, we will list important milestones of language development timeline, then discuss common causes of speech and language delay. Around 4 months, babies can respond to voices. Around 6 months, babies begin to babble and respond to names. Around 9 months, babies begin to produce mama dada. By 12 months, uses gestures such as pointing or waving bye-bye. Around 12 months, toddlers can typically speak 1 or more words. They can produce 2 words with meaning. Around 15 months, toddlers begin to produce jargon, which is defined as pre-linguistic vocalizations. Around 18 months, toddlers can produce 10 words and follow simple commands. Around 24 months, toddlers begin to produce 2 to 3 words and phrases that use I, me, and you, indicating possession. Around 3 years, toddlers are able to use language in numerical terms. Causes of language delay. Autism. There is strong evidence that autism is commonly associated with language delay. Autism is very common disorder, affects around 1 in 44 children. So first suspected underlying cause can be autism. They may also have troubles communicating non-verbally by using hand gestures, eye contact, and facial expressions. Asperger's syndrome, a lost type of autistic spectrum disorder, but at this case, language delay is not presented but they use language with different ways. They may not be able to understand the use of language devices, such as irony and humor. Conversation reciprocity between involved parties. Autism is associated with male sex hormone, testosterone. And autism is more common in boys. Also, language delay is much more common among boys, compared to girls. Another common cause of language delay is intellectual disability. Previously it is called mental retardation. Around 2 to 3% of world population has intellectual disability. Intellectual disability is when IQ is less than 70. The cause of intellectual disability is unknown in most cases. In known cases, it can be caused by genetic disorders like Down syndrome or Fragile X syndrome, or inherited directly from parents. But such cases are rare. Hearing problems. Hearing problems also can affect speech. So an audiologist should test a child's hearing whenever there's a speech concern. Kids who have trouble hearing may have trouble saying, understanding, imitating, and using language. Other causes include maturation delay, developmental language delay, expressive language disorder, developmental expressive aphasia, bilingualism, psychosocial deprivation, elective mutism, receptive aphasia. Cerebral palsy. Helping children learn language. Parents and caregivers are the most important teachers during a child's early years. Children learn language by listening to others speak and by practicing. Children's language and brain skills get stronger if they hear many different words. Parents can help kids responding to the first sounds, gurgles, and gestures a baby makes. Repeating what the child says and adding to it. Talking about the things that a child sees. Asking questions and listening to the answers. Looking at or reading books. Telling stories. Singing songs and sharing rhymes.